I felt a bit of an outcast growing up sometimes. I wasn't in sync with who I was meant to be. I was very feminine, very flamboyant. Yeah, I really like them. Get some nice sandals.
Imagine looking in the mirror and seeing someone nothing like the person you know you are. Lou, who was born male, felt like that every day for almost 2 decades.
I think I'd probably take the sleeves off it.
But having taken the decision to live as a woman, when Lou sought help, she was told nothing was available.
They said that I'd end up having to wait about 2.5 years to be seen, and then it'd be another 6 months throughout consultation. So it'd be 3 years waiting for hormones and any support.
Instead, Lou takes unregulated testosterone blockers she buys on the internet. Her mother worries constantly about what that means for her health.
There was not much I could do as a parent, as she's an adult now and has her own choice. But I know the extremes of suffering that she has to go through.
Julie has watched her young son transform into a woman. But the hardest thing has been the failure of a system which has left Lou facing the darkest of thoughts.
To know that my child could take their own life and have to ask on a weekly basis if that's how she's feeling is not nice for me as a parent.
But changing sex isn't cheap. The average cost of gender reassignment is just over £19,000 per patient. That includes all support, not just surgery. The total cost to the NHS in England last year was over 17 million. This year, the budget's been increased to almost 23 million. The chief executive of the trust, which runs the country's biggest gender clinic, told us his waiting list alone has nearly 2,000 patients on it.
Looking at these figures, isn't the NHS discriminating against trans people?
I don't think it's discriminating consciously, but it's absolutely clear to me that we aren't providing the equal access and equal opportunity. But the capacity inside the services is really under strain. If you want to see more people, you've got to have more staff. And there is a real shortage of people appropriately trained and experienced to do the work.
We've got like a 50s style skirt, you know.
Right now, Lou and others like her find themselves left in limbo, brave enough to change, but helpless to do anything more about it. Rachel Younger, News at 10.